Joining us now is Betsy McCaughey. Betsy's New York's former lieutenant governor, now chairman of the Committee to Reduce Infectious Deaths. Betsy, thank you for being with us today.
Well, you're quite welcome. I'm glad to be on because I have just finished reading the new House bill for health care, what they call reform. And as a patient advocate, I am so shocked at the vicious assault on elderly people and the boomer generation in this bill. And I hope that people listening will protect their parents from what is intended under this bill.
Tell us, you may be one of the few people in America that's read it, Betsy, so congratulations for you. Encourage somebody up there in Congress to do it before it's over with. Tell us what it does in that regard, Betsy.
Okay, well, first of all, this bill is half paid for with a $500 billion cut in health care benefits and services for seniors. So they're bearing half the brunt of this bill themselves. And this is not a matter of eliminating waste or fraud in the system because the Congressional Budget Office has already said only 1% of those cuts will eliminate fraud and waste and abuse. That means they're really cutting patient care. Mm-hmm. And one of the most shocking things I found in this bill, and there were many, is on page 425 where the Congress would make it mandatory, absolutely required, that every 5 years people in Medicare have a required counseling session that will tell them how to end their life sooner, how to decline nutrition, how to decline being hydrated, how to go into hospice care. And by the way, the bill expressly says that if you get sick somewhere in that 5-year period, if you get a cancer diagnosis, for example, you have to go through that session again, all to do what's in society's best interest or your family's best interest and cut your life short. These are such sacred issues of life and death. Government should have nothing to do with this.
My goodness. I've seen bits and parts of it, Betsy, but I didn't know that.
It is.
And can you imagine the response of the American people?
Yes.
When they find this out?
Well, I hope they do find it out. And this is just the latest dangerous, dangerous assault on the elderly. You know, way back in February when the stimulus bill was passed, there was slipped into that bill something called comparative effectiveness research. Now, that sounds good, right, Fred? You'd want to know which drug or which device works best. But this is generally a code for denying care based on a patient's birth date. And the economists are very familiar with how this is done. You take the average cost of the treatment and you divide it by the number of years the patient is likely to benefit. So treatments for age-related diseases like macular degeneration or Alzheimer's or osteoporosis, those treatments are often turned down in England, where this formula is widely used, because the elderly patients have too few years left to benefit. They've got a denominator problem.
For all those listening, you're hearing perhaps for the first time the dirty little secret about what's going on here. The elderly are going to be especially hit on this thing by a Democratic Party that is always trying to scare people about their Social Security benefits and all this kind of stuff. And when George Bush was accused of cutting Medicare or something like that, they went nuts. This is the biggest cram down on the backs of doctors, hospital, and the elderly people in the history of this country.
That's right. And just one example of how this is going to work, in 2006, the British National Health Service issued an edict using comparative effectiveness research. They issued an edict that elderly people with macular degeneration, that's a condition that causes blindness, couldn't get a new drug to save the vision in one eye until they'd already lost their vision in their other eye. Can you imagine? They had to go blind in one eye before they were eligible to get this drug, because that was the cost-effective way to do it.
Well, people will ask, well, why are they doing this? Why would they single out? And the answer, of course, is that's where the money is.
That's right.
People cannot, when Barack Obama talks about saving money in the long run, I mean, as on the other hand, they're talking about raising trillions of dollars in taxes, to pay for it, but saving money in the long run, where do you think he's he's going to get those savings.
By
I mean, it's
losing your mother or father's life.
exactly. And he wants to make it so that if you happen to be able to afford to take care of your mother, or can buy insurance that would do that, or something like that, that you can't do that because that would be unequal treatment. We've got to have equal.
There's that in the bill too. Nobody can get more by paying for it themselves. But here's one of the most dangerous things, Fred. The president's health advisors, these are highly educated, widely published people like Dr. Ezekiel Emanuel. If that name sounds familiar to you, it's because he's the brother of the president's chief of staff, Rahm Emanuel. So he's in a position to put his views into effect. And here's what he says. I've read quite a few of his articles. And he says that people who have incurable or irreversible illnesses should not be given basic health services. And here's the example he gives. This is a direct quote, Fred. An obvious example, says Dr. Emanuel, is not guaranteeing health services to patients with dementia. Imagine denying basic health care to your parent who has Alzheimer's or to your child who has cerebral palsy.
Well, that's what he's doing, and these effective policies that you're talking about. Someone in Washington would, in effect, make a decision for the hundreds of thousands of doctors out there in terms of what kind of treatment is justified with regard to all patients, and you're absolutely right, it's going to hit the elderly the most, because we all know that most of the expenditures are as we get older and in the later stages of life and so forth, and that may be fine in the abstract, but it's not fine for my mama, and I'm not sure it's fine for anybody's.
Doctor, it's Jerry Thompson. Could you let us know where you'll be writing on this, or where? I'm sure there's going to be lots of listeners that want to follow up on this. We'd be happy to post an article on FredThompsonShow.com.
Oh, I would be delighted. And in the meantime, please come to defendyourhealthcare.us for the articles I've already written on the subject, including exposing Dr. Ezekiel Emanuel's very dangerous views.
Excellent. Well, thank you so much for your hard work.
And how much time we got here, folks? We got a minute left. Go ahead.
Point out, everyone listening has been told that if you like your health plan, you can keep it. And about 80% of Americans like their health insurance.
Right.
But it is not true. That's simply a lie. If you look on pages 16 and 17 of this new House bill, it makes it clear that you cannot keep your health insurance. You're going to be forced to switch to a low-grade HMO-type plan that's going to limit your access to specialists and tests, and you're going to pay a lot more in higher taxes for this health plan you don't want.
People are not going to buy this. That's why the president is trying to rush this through as fast as they are. But thanks to people like you, Betsy, and we'll try to do our part in enlightening the people as to what's in this legislation. Thank you so much for being with us.
You're quite welcome.